moment and then we will start. Just bear with me. Okay, we are live, so I'm going to get us started. Thanks everyone for joining us today. It is another media briefing and it is Wednesday, May 6th. Today we will have statements from all three of our panel members. We'll start off with Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by Regional Chair Karen Redman, and finally an enforcement update from our CAO, Mike Murray. So without further ado, I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Thank you, Bethany. Hello. So very sadly, we continue to see COVID-19 related deaths in our community. To date, 94 people have died. I wish to express my deepest condolences again to all the families, friends, and caregivers who have lost loved ones to COVID-19. There are currently 14 long-term care or retirement homes in outbreak. 395 people have now recovered from COVID-19 in our community. We continue to refine and refresh our dashboard as information becomes available and as we're able to get to the refinements that we wish to put on the dashboard. To accommodate new types of information, the layout of the dashboard, as I think a lot of you have already noticed, has changed. But I just wanted to reinforce that in case there are any citizens who are looking at our dashboard and they don't realize that now, because we have more data as part of our dashboard, we've had to split the dashboard up into 3 main sections that people can get through one of the main tabs. So I'm just gonna, maybe I'll see if I can actually share the screen and just show that to everyone. I mean, I suspect the reporters are already aware, but I know sometimes we've heard that people are struggling to find the info they're looking for. So for example, this is the landing page, and here are the 3 tabs that I was referring to: epicurves, characteristics, and outbreaks. So you can see, for example, if somebody wants to see the list of outbreaks, they click on that tab and it's still there. All the data is still there. Yeah, so I just wanted to highlight that. And as of this morning, I'll probably stop sharing now. So as of this morning, the epicurves on our dashboard are differentiating between cases that are associated with a facility outbreak and cases that are not. So what it shows is that Waterloo Region's epicurve is actually a tale of 2 curves, one showing that community spread has slowed down, but the other showing the significant contribution of cases associated with facility outbreaks, in particular in long-term care homes and retirement homes, to our overall case count. The greatly expanded testing in those prioritized groups is filling up the increased lab capacity across the province, and the province is continuing to build upon that capacity within the recently expanded lab system as well. So there have been a number of labs that have come on board, and so it's a bigger system, but it's still a relatively new system, and so they're building upon that. And so all that to say is that what we expect is that our number of confirmed cases, as well as our number of persons tested, will continue to grow. I forgot to mention just very quickly, I'll just share my screen again. Where is this? Right, okay. So I'll just mention, for example, if I go back to the landing page and look at the epi curves, we've also put in some markers to show some key milestones in terms of when your province expanded the priority groups. So I have some dates here, and you can see these markers overlaid on top of the epi curve. So you can sort of see what's happened after those expansions of testing. Okay. I also want to say a few words about Mental Health Week. So as this is a Mental Health Week in Canada, we have an opportunity to reflect on the huge changes that have taken place in our lives. Since the beginning of the pandemic, our daily routines have been dramatically transformed. Things we once took for granted, myself included, like visiting a loved one, hugging a grandchild, meeting friends for coffee, are no longer freely accessible to us. Significant change can take a toll on our mental well-being, but there are some steps that we can take to try to ease the burden. For example, I encourage all residents, including myself, to take breaks from the news and social media from time to time. This will help us avoid being overloaded with information. I encourage residents to continue to try and connect with others through other means. So even with physical distancing measures in place, to still connect with us, with those close to us in meaningful ways through technology, for example. And these connections are probably more important than ever. And finally, I'd like to encourage residents to, continue to try and take care of our bodies and to make time to unwind. So we have some good resources that promote mental health well-being on our public health website, regionofwaterloo.ca/ph, and also on public health social media channels. They're there for you. So please, visit those resources if you are interested, and please continue to look after yourselves in terms of your mental health. So in closing, as I mentioned on Monday, we are at an important point in Waterloo Region in our fight against COVID. We have made significant gains. We need to hold on to those. This is due to the work that we have done collectively by practicing physical distancing, by limiting the number of trips we are taking outside, and by washing our hands regularly. But the gains we have made are precarious, and they are at risk if we let up too soon. The path going forward is going to be very slow, much slower than what we'd all like. It may be hard to imagine at this point, but slow is actually the fastest way. So we all need to continue to stay the course. Thank you very much.
Thanks, Dr. Wang. I will pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. Dr. Wang talked about Mental Health Week and some things we can do to maintain our mental well-being. I want to draw attention to our older citizens and the unique challenges they might be facing during this pandemic. People over 70 are at a higher risk of experiencing isolation and maybe even loneliness. They may not be linked into the services during COVID-19 for a variety of reasons. If you are self-isolating or not able to drive and find yourself struggling, here are a few things you can do to feel safe, connected, and vibrant during this necessary time of physical distancing. Focus on the things you can control, like eating healthy, keeping active, sleeping well. Keep your regular routine as much as possible. Stay connected to family, friends, and community. Rely on accurate information from trustworthy sources. Set limits on how much news you watch, and try something new or rediscover an old interest. It's normal to feel overwhelmed, stressed, or anxious. Try to begin and end your day with positive thoughts. There are services for older adults in our cities and in our townships, and I encourage you to reach out if you feel you need support. Thank you.
Thanks, Karen. Last but not least, I will pass it over to CAO Mike Murray. Go ahead, Mike. Are you muted, Mike?
Got it. Yep. Thanks,
There you go.
Bethany. So our regular Wednesday update on monitoring compliance and enforcement activities. So what I'm going to give you today is are the data from April 28th to May the 4th. So basically the last week of activity. I also have the cumulative totals if anybody wants to ask about that, but I just thought the week by week is probably more informative and helpful. So over the last week, we've had 1,094 contacts. So that could be emails, phone calls, responses. So 1,094. Of those, 670 involved a site visit by someone, public health inspector, bylaw enforcement officer, whoever, for the purposes of education, interaction, sometimes issuing warnings. So 670 site visits and warnings, 360 site visits where no action was required. And as we've said before, either they got there and there were nobody there, they got there and whatever was happening was actually completely appropriate. And then 60 phone calls. We think that that doesn't capture all the phone calls. That captures calls that are coming to the region, but there may be other calls in addition to that. And 4 new charges laid over the last week. So as always, I'll just give you the sort of high level category. One was a personal service setting, particularly a nail salon in Kitchener. One was a private residence in Waterloo, social gathering of more than 5 people. One was in a public space in Cambridge. Again, too many people gathered in one place. There was actually 2 of those in Cambridge, 2 separate incidents in public spaces in Cambridge with more than 5 people gathered together and failing to comply with the order. So that's a high level overview of the monitoring, enforcement and compliance activity for the past week. Thank you.
Thanks, Mike. Okay, we are going to turn it over for media questions. I will start with Robert from Rogers.
Hello, thank you. My question's for Dr. Hsiu-Li Wang. Dr. Wang, there's been claims about a US government-ran study that there's now a new, more dominant, more contagious strain of the coronavirus. Has there been any information shared with the region about that and how we plan on moving forward with something like this?
Hi, Robert. Good to see you, and thanks for your question. So I know that those types of studies are being monitored by a provincial group of experts who look at the studies, because we have to look at the body of evidence in addition to individual studies. And I think what's important is that at this time, the measures wouldn't change regardless of, if the virus has become stronger. We are still doing what we need to do to try to prevent cases. And so we're just going to continue to focus on those actions because they would be, our best measures in terms of how to address this virus. So if we get more information, we'll definitely share with our community.
Perfect. So is there a possibility that we could see stricter restrictions in the region if there's even more of a possibility of another curve coming of our current strain?
Yeah, I'm gonna actually take a line from Mike. I don't really want to speculate on things that, for which I wouldn't have information to base projections on. I would just say that right now, what we're seeing is what we're seeing in the community, like was showing with the curves. Now, our community spread is slowing down. We still have a lot of cases in long-term care and retirement homes. And our focus is going to be on the day-to-day in the coming weeks to, fight this first wave. And then, the data that we have goes up to the province, and they also have experts looking at projections ahead and what may come of those. But what may come in the future depends a lot on what we do now. So from a local public health perspective, we need to continue to focus on the fight that's going on right now.
Perfect. Thanks so much. That's all I had.
Thanks.
Thanks, Robert. Okay, I will pass the microphone over to Ben from 570.
Good morning. This is a question for Dr. Wang.
Yes.
So I'm going to kind of go off yesterday's data because of Doug Ford being out yesterday with calling out health officials for testing. So Ontario has conducted, as of yesterday, 342, just over that, 1,000 tests for a population of about 13.6 million. And by our math, that works out to about 2,500 tests per 100,000 population. So Waterloo Region, with a population of around 560,000, has, as of yesterday, 7,500 tests, and we're just above that today. So if we were at the provincial average, it looks like we would be about 14,000 tests by now. So the question is, are we one of the regions being called out by the province, and are we doing enough testing?
We'd be at 14,000 tests a day. Is that what you were saying?
By now, I think if it was at the provincial average.
Well, I'm sorry, I'm not necessarily following, but I think I understand the point of your question. I think we have to consider a few things. One, before the early part of April, when we started to, and we see on the graph, when the province started to expand testing, we had significant shortages of swab supplies. So we couldn't even do more testing if we wanted to. Then the province, has and continues to put out guidance on what the priority groups are for testing. And we have actually been scaling up the testing progressively as much as we can since then. So if I take a look at some of the data, so from April 21st to 30th, we tested an average of 206 people daily in Waterloo Region. This is an increase from an average of 138 people from April 11th to 20th, and an average of 113 people from April the 1st to the 10th. And we have 56 long-term care home and retirement home facilities in Waterloo Region. And even though the province has asked that all long-term care facilities in the region be tested in the next couple of weeks, we are testing. The plan for us is, and so far we're on track, to complete testing in all long-term care home and retirement homes in the region in the next couple of weeks. As public health units, we do not do the testing ourselves. So we are working hard with our community healthcare partners who are doing the testing to continue to increase the number of tests performed in our community, including the testing in all long-term care home, retirement homes, etc., essential childcare centers that are now part of the priority list. So we very much appreciate our health partners' support. And we will continue to, work with them on increasing testing rates going forward.
Okay, thank you. And I know you mentioned on Monday that Waterloo Region's EpiCurve started a bit later than some other municipalities. Does that, and the fact that we're really focusing on priority groups, is that kind of why it seems like we might be lagging behind as far as the provincial rate goes?
Yeah, I think we have to be careful about directly comparing the provincial rate and then extrapolating just based on our population, our local rate. Yes, definitely. You know, the fact that our curve, the timing isn't exactly the same as some other areas who have gone ahead of us, who have much larger populations and who have tested a whole bunch more people because they've gone earlier. Yes, that's going to factor into that somehow. The important thing I think we need to know is we all know and we all understand that we want to improve testing rates. I probably, more than anyone, want to improve testing rates. And so what we've seen from some of the numbers that I've given is that when we had the capacity, we kept scaling up and improving our testing rates. And we are continuing to plan in the future for that. And so, you know, that's high priority for all the healthcare partners that we work with in improving testing. And so we're just gonna keep working on that. And, you know, that in itself, I think over time will even out. Yeah.
Okay, and just a final follow-up. You mentioned we did have a
Sure.
significant shortage at the beginning. Do we
Mhm.
still have a shortage of swabs here in the region?
We don't have a shortage of swabs anymore. We're getting the quantities that we're ordering. There's no restrictions on them now. That said, you know, I know that the province has scaled up lab capacity, and they're very much, you know, wanting to continue to do that. But it is a whole lab system being built as we're going through the pandemic, right? A whole system of different players being added now. This is complex. And what we understand is that, you know, with all the swabs that we're submitting now, because we're submitting a lot, this is filling up the lab capacity that has been created and possibly at times testing it. And so, you know, we need to be also cognizant of the fact that we need to try to, you know, also part of the work that we're doing with partners, for instance, is making sure that as much as possible, we are planful in how many, you know, that we submit every day so as to not overwhelm the lab system at any one time and potentially waste swabs that have to be discarded with people having to be tested again. So we don't want that to happen. But you know, there are challenges that can occur when you have a whole system being built at the same time as you're going through the pandemic. And so we're trying to work with our partners and our lab partners who are really trying their best as well to, you know, scale up consistently, regularly in a way that continues to allow the provincial lab system, which is a provincial oversight responsibility, that allow the provincial lab system to continue to manage the increase in terms of tests that keep going in. So that's part of the picture as well. It's not local medical officers of health saying one day, oh, you know, I'm just going to test this number of people. It's a much more, I'm sure you know that as well, but sometimes people just, you know, they'll hear things on the media and they'll just think, oh, it's you know, somebody's fault that the tests have gone down for one day. And we do know that those kinds of fluctuations from day to day in provincial testing numbers, that can be affected by a number of issues, including some of the things that the chief medical officer talked about yesterday, which is, you know, over the weekend, they don't have a good system right now provincially for couriering or tests over the weekends. So what ends up happening is that the numbers drop on Mondays, right? And so that's also part of the issue, isn't because that one day suddenly we all decided, medical officers, how we would test less people. So anyway, so it's just, sorry, I'll stop there. But it's just to, I think the key takeaway is that we are very conscious of the importance of testing, and we're gonna do our very best along with our great partners that are also ramping up their capacity to continue to increase rates of testing. Thanks.
Thank you.
Thanks, Ben. Okay, I will pass it over to Kate from CBC. Go ahead, Kate.
Thanks. My internet's being a bit spotty, so apologies if that results in me freezing. Dr. Wang, how long are lab results taking now to come back?
That's a very good question. So, we've seen provincial releases that say it's 24 or 48 hours. Due to some of the complexities that are being worked on very, very hard by all partners across the system, including our lab partners. It's not always 24, 48 hours, right? It can take a number of days. What we do know is that though for outbreaks and for patients that are critically ill, for example, those are going to be prioritized by the lab system to come back quicker, right? But if, for example, you're somebody in a priority group that's in the community, but you're not hospitalized, it can take a number of days. I've heard 5 to 7 days that it can still take for the results to come back in. And I think it's probably due to the fact that there's a very significant increase now in the numbers that are being submitted because of all the homes that are being tested. And so that's part of what I was trying to explain in terms of the complexity of the whole system, and that it's not going to be 24, 48 hours for everybody. There's also that 24, 48 hours does not take into account the time that it takes to get the sample to the lab and then to get the results from the lab to public health. So that can incur additional days up on top of the 24, 40 hours that takes the lab to turn around the results. That said, the signs that I'm seeing is that everybody is working really hard. That at least we do know that some of the priority tests, such as the tests in long-term care homes and retirement homes, tend to come back faster, and tend to try to. The lab turnaround at least tends to track 24, 48 hours, maybe a little more. So what that tells me is that the lab system is trying to prioritize as much as possible. And that's a good thing.
Yeah. And also I wanted to ask, yesterday, Premier Ford kind of said, cottage country folks, I can't stop them from going to their cottages. And with the nicer weather ahead, people are saying, oh, this is going to get harder and harder. Is there any kind of conversation about changing the messaging from stay home to here's how to protect yourself when you're out?
Mm-hmm. No, that's a good question. I think that kind of change needs to be gradual. There is, as we've seen in the media, through the media, there is that tension between people wanting, for example, to go to their cottage and residents in those areas not wanting an influx of people, given that their health system or other structures are not really. They're relatively small. I think for me, what I would like to ask people to do right now is to stay the course with our recommendations. We do know we want to move towards letting up the restrictions, and the province is taking a look at our data as well as data from other areas, and being often quite directive about what can open up when, and that's going to already start to happen. Like some of the businesses are going to start to ramp up, and so we're going to start to have more social interaction, the important thing is that increase in social interaction is done at a gradual pace, so that we can closely monitor whether or not that leads to increases, and make sure that the number of cases that continue to appear at a rate that's manageable, and hopefully continues to go down. But it will be a delicate balance. And so my message is still for residents in Waterloo Region to please stay the course with what we've recommended to date.
Great, thank you very much. I'm done.
Thank you, Kate. I will pass it over to Nicole from CTV.
Hey, good morning. You talked about the lab capacity. Are we doing them here or shipping them to Toronto for processing?
Okay, that's a really good question. So that the lab system is something that is overseen by the province. So, basically, the clinics, the long-term care homes, whoever is doing the testing, they ship to certain labs. And then if those labs can't handle the volume because they're too busy, they get shipped to other labs. It's this very complicated network, or I should say very complex network, not necessarily complicated, but just complex. And it's meant to try to make sure that, you know, it's not dependent on specific labs only. It can get rerouted as needed to other labs that have capacity. But it is a very complex system. And as I mentioned, it's being built as, you know, as we're going along. And so it's not a specific, like, I don't know if our samples, any one sample taken can be, you know, might go to London or Hamilton or Toronto, but, you know, or, but that's an example of the places that the samples from here can go to. And, you know, I've seen great examples of really, you know, the lab system working really hard to reroute samples from a particular lab that they generally should be sent to another lab, you know, that may have more capacity at that specific time. So it's a lot of real-time work. And, you know, yeah, that gives you a bit of a picture.
Do we have any here in Waterloo region? You mentioned London and Hamilton and Toronto.
Yeah, that's generally where the labs are, where the labs are sent. I mean, they're those are the main labs, I would say, for our samples. But there are also, now we have also some private labs that have, you know, joined the network, and so sometimes they can go to the private labs. I don't know of all the labs right now, and you know, there could be more added as I'm talking, but those have been traditionally the large centers that we've been sending samples to.
But are there any here?
Yeah, there can be some local capacity, for example, Grand River Hospital, but you know, I'm actually not I'm not the most up to date on exactly what capacity locally we have. I just know that the major labs are those labs.
Okay. Now,
Public labs are those labs.
okay. It's our understanding that public health takes the lead for managing infection control and outbreaks. The province has said public health is in charge of the local response to COVID. If you're the lead, why do we have to wait for feedback or input from the province when dealing with outbreaks, when you have the power to act unilaterally?
Yeah, thanks for the question. I think there may be a little bit, you know, more information that needs to be sort of provided for that. All local medical officers of health have the power to act, you know, locally, and we do act locally. You know, what we also get from the province are expert guidelines, right? We don't have experts locally that take a look at all of the studies that come in and then translate that into guidelines. So we do rely quite a bit on the bodies that have been mandated to look at this type of evidence and then to provide to local health units the evidence and the guidance on addressing outbreaks. So we do that. We apply the guidance. We work with homes every year on outbreaks, but they're the outbreaks of viruses that we know that we're quite familiar with, like influenza or gastrointestinal outbreaks or outbreaks of other respiratory viruses. COVID is a very special situation. It's a new virus. We're learning about it as we go, and the province is providing the best expert guidance that they can. So it would make sense for us to take advantage of that expertise and use that guidance to apply it locally. But we can and do make adjustments as needed. So there's a few instances, for example, where I have gone beyond the guidance earlier than the province in certain outbreaks. So yes, I can use my judgment in order to make those decisions. But you know, by and large, I want to rely on the latest evidence from experts. But I think it's not a dichotomy. It's not like I don't act. We're acting every single day. So I don't know if that helps. I don't know what the sort of assumption is behind the question, so I'm not sure if that helps, but let me know.
Okay, let's then perhaps speak specifically about Forest Heights, because there are again additional deaths there, and the cases are continuing to climb. So, have you done anything above and beyond besides the additional steps that were taken, I guess, in the last couple of days for new staff to come in from Grand River Hospital, and transferring of new residents? Have you gone in there and said, we need to do even more because what we're doing isn't enough?
Okay, so Forest Heights, yeah, no, it's a very significant challenge. I think you may have noticed there are a number of outbreaks that have been declared, including a number that have been declared over, and public health is involved in all of them, including a number that have very quickly come under control and that have been called over, or that, even now, even though they're an outbreak, they're under control. And they're, we're trending towards being able to release them from outbreaks soon. So I think we need to also take a look at the bigger picture in terms of outbreak control. We do have a mandate as public health units to support the homes that are an outbreak, to make sure they understand, what are the requirements that we need to have in place when they are experiencing outbreak. I think, it is absolutely true that Forest Heights has a very significant outbreak, and there's been a few others that have had, outbreaks that with a number of cases. Forest Heights is definitely the most significant of them all, right? And so it's been a very challenging outbreak to bring under control. In Forest Heights particular, yes, I have put in guidance that has preceded that of the province. For example, guidance on testing everyone, guidance on, having all the staff mask themselves. It has come out before the province has come out with those requirements. So yes, I've used my discretion because I was seeing that in Forest Heights, things were not evolving the way that, we were hoping. It remains a very challenging situation. I am very sad about that. What we have been doing, continue to do, and it's not just in the last couple of days, it's been in the last weeks, continue to bring in place additional reinforcements and supports as we found it necessary. Yesterday we just did our 5th on-site inspection of Forest Heights, along with partners, from Grand River Hospital, and recently we've also had someone from the Ministry of Long-Term Care join us in person. And every day we work with Forest Heights, we work with Rivera, and we work with the Ministry of Long-Term Care and our hospital partners to try to continue to help them manage this outbreak and bring it under control. It is very sad that we are seeing the deaths that we are seeing now. Deaths tend to be a lagging, I shouldn't say, I was going to say lagging indicator, but what I mean is they tend to occur quite a bit of time after infection has occurred or spread has occurred and people become sick. And so we're seeing this across the province now, that the deaths in long-term care homes and retirement homes are increasing. We are trending similar to the province in that way, in that we are starting to see the same thing. So it's a very sad situation. Forest Heights and Rivera, we're working with them every day. Their staff, especially the staff at Forest Heights, they are working so hard every day to try to manage. It is an exceptional outbreak, and the size and scope of it is very large. And so it is something that is very challenging. So we're continuing to make those efforts every day.
I had to mute myself. My son was a little loud. One more question, just scrolling through. Columbia Forest on their website says they have a staff member who has tested positive. It's a facility in Waterloo. It's not listed. So I'm just wondering, should the number read 15 then?
Yeah, sorry, the number 15? Oh, in terms of outbreaks.
Yeah,
Okay.
yeah.
Yeah, so two things to be aware of. One, we always let the facility inform their residents, their staff, the residents' family first. We think that's very important. The dashboard is not meant to be a real-time tool. It's meant to be a tool that is updated daily to keep people informed, to keep our community informed. But the most important thing is that when a facility goes under outbreak, they need to inform their residents, families, their staff first. So it's very possible that we give them some time, like, 24 hours to do that before we post. And so that could be a reason why they could be going out and saying, and I'm glad they are, because that shows that they're keeping their community informed. We have this number of cases, we have that, number of whatever, the numbers of cases that we have, et cetera. And then if we're following that up the next day, that's great. That just means that they've gone ahead and done what they needed to do. And then by tomorrow's refresh, we should have that number. So that's why there could be that bit of delay on our dashboard.
And I have like a really small question for Mike Murray. In terms of the amount of charges, you said there were 4 last week. Does that bring the total now to 11 since the start of the pandemic?
Nicole, by our count, it brings it to 10.
Okay.
I think there were 6 previously and 4 last week, for
Okay,
a total
perfect.
of 10.
Okay, thank you.
Okay, thanks, Nicole. We still have 4 more reporters lined up to ask questions, so I'm going to try to keep us moving along. I will pass it over to Damon from the Woolwich Observer. Go ahead, Damon.
Hello. I'm not sure if you guys can hear me, and I can't see you, so if
We can hear
anything, you can cut me off. Perfect. So I'm just one question for Dr. Wang. I got a call from a concerned Woolwich resident, and she was very confused about the numbers per cases per 100,000 population by municipality. Could you explain those numbers more clearly for the public?
It might help if I knew what she was confused about, or if you could help me understand that.
So on the site, it says 172.2 out of 100K for Woolwich. Can you explain these numbers? Because a lot of people are under the impression these are the exact case numbers for the regions.
No. Oh, look at that. My dashboard is not working. Sorry, I was trying to look at it while you were talking. So it's the rate. It's the number of cases per 100,000 people, right? So it's not the actual number, but rate is a better indicator because we know that some municipalities have fewer people, others have more people. So rates is gonna make it a bit more equitable in terms of the comparison of the rates per municipality. But one of the things that's important is I think not to rely on those numbers as saying, that's really that's representative of the spread across the area municipalities, right? Because we know that is going to be skewed by who's the priority groups that are being tested. But yeah, those are the numbers per 100,000. So yeah, I don't know if that helps.
Yep. And then so there's a large number here, the 142.2 out of the 100,000. A lot of people are worried those are coming from specifically community transmissions, but these also could come from these smaller private homes, correct?
Yes. So I think if you see on the graph, there's 2 colors. There's a lighter color, I think, that represents those cases that are associated with facilities that are an outbreak. And yes, those facilities could include, group homes and other congregate settings of vulnerable people, for which we are not listing facility by facility, but we're grouping together under group homes outbreaks because they can be very small and we can identify them if we do that. So yes, that can definitely, and I think you'll see for Woolwich that does account for a very significant part of their rate.
Okay, perfect. Thank you for your time.
Okay, thanks, Damon. I will pass it over to Joanna from the record. Go ahead, Joanna.
Great, thank you. A couple questions for Dr. Wang. Just regarding the Premier's comments yesterday, do you think it was fair of him to point the blame, although he didn't specifically say who, but to point the blame at medical officers for not doing enough testing?
Well, I think the Premier is trying his best, like we all are, and he, obviously wants to see testing results go up. I think what is important to understand is that we are trying very hard to work with our partners who actually do the testing to make sure that those rates continue to climb in terms of testing. I think we're on the right path in Waterloo Region because we continue to, since swab capacity and lab capacity has increased significantly, which is a good thing. We have continued to increase the numbers that are tested here. And my focus right now, and I hope, I'm just going to keep focusing on that, is to continue to improve those testing rates going forward. And then, and I think that's what everybody wants.
And sorry, just to clarify, so it's not public health who's doing the testing, but partners?
Exactly. So public health doesn't do testing, and they haven't never done testing. And what we is the partners, is the clinical partners that do the testing. So for example, the medical directors of the long-term care homes and retirement homes will order testing for their residents. We provide them advice about who to test in an outbreak situation, but they will do the testing. They will make the requisitions for those patients. The staff of the long-term care homes, under the direction of the medical director, will take those swabs. In a community assessment center or one of the hospital assessment clinics, it will be the clinicians and the staff of those clinics or centers that actually take the tests, or either the clinician directly or staff under medical directive from the clinician that oversees the testing clinic. So all the testing is done by our partners, and they're very valued, and they are working really hard to increase capacity of testing. The province in the meantime has also prioritized groups. So if you go on their website to do the self-assessment and you're not in one of the groups, you are going to be referred to go home and self-isolate. So this reflects how provincially we have prioritized testing. What I'm very hopeful of, and what we continue to work on in partnership with all those clinical partners who do the testing, as I mentioned, is to open up that testing as soon as we can. Right now, we are still having to, carry out the directives of the province to test everyone in all the homes. As I mentioned, we have 56. We're actually going beyond the requirement of the province because we're not treating retirement homes differently than long-term care homes in our region. We find it's equally important to test them because they have had outbreaks and they are vulnerable as well. So we are working on meeting and exceeding those requirements of testing. And so right now, there's a lot of focus on that, a lot of swabs going in from those homes. And we can't expand testing right now to the broader population. But our hope is that, soon the province and ourselves will be able to expand testing to the general population. And yeah, sorry, I lost my thought there. But that gives you yeah, that's how it is. I mean, my assumption is that the Premier understands that local medical officers of health, play a key role amongst other partners in the healthcare system in terms of responding to COVID. And he wants us to get the message. Yes, we want testing rates in our communities to be high. We totally agree with that message in our community, and we are working with our testing partners to try to increase that capacity as quickly as we can.
And then just looking at some numbers about increases in testing locally versus provincially in the second half of April, you'll see the province, the numbers have increased dramatically every day versus in the region, it's been fairly nominal, like 2 or 3% a day. So why is there that difference then?
I don't know why right now, why there's that difference. I mean, that's something that I'd like to take a look at later in more detail. But I do know that what we're doing now is filling up the lab capacity that we have, and that we're going to continue with our efforts to increase our testing rates. And we're just going to keep going on that path.
And then, so just following that, is the region doing enough testing or as much testing as is available to be done locally? Yeah,
the region is doing as much testing as is available. There are local variations, regional variations in terms of supply and lab capacity. They will even themselves out over time, but at any one time they're not exactly the same across the province. And but it's definitely very important to me that our testing rates continue to go up. And right now, you're right, Joanna, what we're doing right now is as much as the system. We are maximizing the testing within the capacity of the system right now.
Anything further, Joanna?
Nope, that's it. Thank you.
Great, thanks so much. Okay, I will pass it on to Kevin from Global.
I'm good, thank you. Nothing for me today, thanks.
Okay, great. And I believe Irene is the last person. Go ahead, Irene.
No questions, thank you.
Okay, I will do a final ask. Is there any questions anybody missed? Doesn't look like any hands waving. Okay, thanks guys for joining us and continuing to share our messages. We will be back at it on Friday. So thanks again, and we'll see you next time. Bye-bye.
Thanks so much. Bye-bye.